The biggest challenge that I see facing patients today is accessing the healthcare system when they need it and having access to a provider that knows them, that they feel comfortable with, that you're able to see consistently, and that you're able to see when you need them. When healthcare gets very fragmented and some things are being done by your PCP and maybe some things are being done by someone else covering in that practice, and some things are done at the ER and some are done in urgent care, stuff can slip through the cracks. Just the process of when you show up. Do you have your insurance card? Do you have, is it up to date? Do you have a copay? Do you still owe us from your last visit so you have a pending balance? Is this going to need a prior authorization? Is this person in your network? I mean, even in the best situation, you only have so much time. There's somebody else waiting. It can vary from 5 to 10 minutes with a patient, maybe to 20 minutes or a half an hour. That's about it. It's hard to make real health changes and real inroads with patients when that's always in the back of your mind. The clock is ticking, other people are waiting. Put all that together and it's just barriers for people to come in and access care. This type of practice would afford me the ability to just take as much time as it takes. If there's a health situation that arises and you need to see me several times in 1 week, then you see me several times in 1 week. It might only be an annual physical where we spend an hour and a half, and we set some goals, and maybe we touch base 2 or 3 times over the year. I can be there when they need me. So I know them well enough so that when they call, I know who they are, and I'm able to just meet their needs. And so many things down the line in healthcare, and procedures and hospitalizations and all of that stuff that happens, most of that could be nipped in the bud if preventive care was a priority. Knowing the different recommended screening tests that would help detect things early that might be changing or occurring in your body. Making a customized plan around your lifestyle and your family history, different things in your life or different exposures or incidents that might have happened that might put you at higher risk for other health conditions down the road. Identifying those, being aware of those. Preventive care is huge, and I think it should really be way more at the center of our healthcare system. The type of patients that I think would be a great fit for TruePath Wellness, their health matters to them. They want a close relationship with a provider that will give them real and honest advice, that will be there when they need them to be there. I think their time matters to them, and they are done working within the limitations of the larger healthcare system, and they want to reach out to their provider directly and not on how insurance or the larger system says that they can access it.